Welcome everybody to the Kessinger Specific Chiropractic Patient Orientation class. We thank you all for being here and listening to what we have to say, watching this video, so that we can all learn some stuff and be healthier and be happier and be more terrific. So I know some of you see Dr. Ariel or Dr. Whalen more than you see me in the office, but it's my turn to teach this class, so now you are all stuck with me for the next 3 to 4 hours. So sit tight. I'm just kidding, not 3 to 4 hours. But anyway, some of the stuff we're going to talk about tonight, kind of what is health, how do you get health when you've lost it, how do you keep your health when you have it, how to get the most benefit out of our care, how to not undo what we're trying to fix, how to get better faster, stuff like that. We're also going to talk about the difference in healthcare models. Maybe some of you don't know that there is a difference in healthcare models, but hopefully we have that kind of hammered out by the end of the night. We're going to talk about a few things such as traumas, stress, toxins, and spinal neglect, and how they lead to poor health, but the main two are traumas and spinal neglect. Basically, having an injury to the spine, damage in the spine, and then just letting it get worse as time goes on and how that can lead to poor health. One of the other things is we're trying to give you good, hopefully quality information so that we can all make healthier choices, better decisions about our health now and into the future as well. So to move on to the next point, I'm going to tell you a story. This story is about a young guy, 18 years old, coming out of high school, going into college. This guy was a soccer player. He was a soccer player in high school, and then he got a scholarship to play soccer in college. And so in the summer months between high school and college, he was training in the weight room, doing deadlifts. Hopefully you all know what deadlifts are, but he was doing deadlifts. Have done these 1,000 times before, different weights, things like that. And so he's doing the deadlifts in the gym, and on this particular time, on the way up, he feels something pop really loud in his lower back. And couldn't straighten up after that, had a shooting pain in the back, going down the leg into the foot. You kind of had somebody help him put the stuff away, but hobbled home and just kind of laid in bed and didn't know what to do about it. And took medications, iced it, heated it, stretched, all that kind of stuff, tried to sleep, couldn't sleep, thought, hey, I'm a young guy, I've never had this happen before, I probably pulled a muscle in my back, and it'll be fine in the next day or two. So goes to sleep, wakes up the next day, and everything is the same, or maybe even worse. And still didn't know what to do about it. Tried the medication again, tried the ice again, tried the heat again, and things were just kind of staying the same. Still had the back pain down the leg into the foot. And then, so this went on for about 2 or 3 weeks with good days and bad days. Couldn't play soccer, couldn't practice, couldn't weight lift, couldn't even really sleep or function. School was starting, couldn't really sit down for very long, so couldn't go to class. So really affecting his life. So he didn't know what to do about it. But at the time, luckily, one of his friends met a chiropractor in the mall doing spinal screenings. And he said, hey, I met this guy, I don't know what a chiropractor is, but maybe you should go check it out because his sign says he can help back pain and you seem like you have a lot of back pain. So he goes in and he gets checked and he gets examined and they take x-rays and he says, hey, you probably have a bulging disc in your lower back, which is putting pressure on a nerve going down your leg, and that's what's causing the pain. And here's what we're going to do about it. We're going to adjust the second bone down in your neck. And he's like, that doesn't make any sense, but my back hurts, my leg hurts, my foot hurts, my neck feels fine. But he goes ahead and he gets adjusted, and then he goes home and he wakes up the next day and everything is about the same. Nothing changed. He still has the back pain shooting down the leg into the foot. And so he goes back in and he gets checked and he gets worked on and he goes back and he gets checked and he gets worked on. And this goes on for about 3 weeks. 3 weeks go by and he's having ups and downs and good days and bad days. But about the 3-week mark, things start getting a little better and a little better and a little better and a little better. And finally, after 3 to 4 months, things finally are gone. The pain in the back is gone. The pain in the leg is gone. And back to life, back to sleep, back to school. Not quite back to sports yet, but just back to life. And so I tell you this story, not because all of you have back pain or the same thing that I'm talking about. I tell you this story because this person was myself. This is how I got into this profession. I was going to be an architect for the longest time, and I hurt myself, and chiropractic helped me out so much. And so now I get to talk to you all about how chiropractic can help you out as well. So we'll move on from that into the next portion of things. All right, let's talk about our current healthcare system, our current healthcare model. It's undeniable that we in America have one of the best healthcare, well, the best stuff in the world. We have some of the best facilities, some of the best schooling, some of the best doctors, some of the best technology. If it's out there in the medical field, we cannot deny that we can have access to it if we can pay for it, if our insurance will pay for it here in the United States. And another point of this is we as Americans consume about 80% of the world's manufactured medications. 80%, that's a huge number. And so we have a lot of cool stuff, we consume a lot of medications, and also America spends a lot of money on healthcare. Last year, 2019, we spent about $4 trillion on healthcare, which is more than double the average among developed countries. So we have a lot of cool stuff, we take a lot of medications, and we spend a lot of money on healthcare. But yet, we still rank 79th out of 81 countries on this thing called the Total Health Index, which is a measurement on how basically healthy our country is. And so even though we have all these cool things, we're not a very healthy country in general. Most people, the most common thinking, most people think if I have a symptom, I must therefore have poor health. And if I have no symptoms at all, I'm pretty healthy. And the objective of everything that we do is to relieve some sort of symptom. Take this to get rid of that, or take this to get rid of that type of thing. And the problem that we run into is we are judging our health solely based on how we feel, not on how our bodies are functioning. So let me give you some examples of how we can be pain-free, symptom-free, feel fine, but our bodies are functioning the way are not functioning the way they're supposed to. So who's been to the dentist? I've been to the dentist. I'm sure you guys have been to the dentist before as well. Who's ever been to the dentist and went in for your regular cleaning and they clean your mouth, they look in there and they find, oh, there's a cavity in there and we got to fill that cavity. I had no pain, had no symptoms, had no sensitivity to cold, but I had a problem. And however small that problem may be, if I let it go further and further and further, things are going to get worse to a point where there will be bigger problems going on. So no pain, no symptoms, but still something's going wrong. The 3 leading causes of death in the United States: heart disease, cancer, and strokes. The early warning signs of these things are usually nothing or not much at all. You probably all know somebody who's had a heart attack. We're going along fine in life and maybe mowing the grass and all of a sudden just had a heart attack or a stroke. Cancer, by the time somebody finds out or is diagnosed with some sort of cancer, it's usually been developing for years, and we've all been around people or had it in our lives, that type of thing. So the early warning signs of these things are not a whole lot, even though there's a lot of stuff, symptoms, issues going on in the body. So let's flip over that coin and look at how we can have pain, have symptoms, and be functioning, be healthy, be functioning the way our bodies are supposed to. So have you ever had food poisoning before? I never have, but I know what it is, and if you've had it, you know what it is. If you eat this food that's tainted with a bacteria or a virus that causes food poisoning, your body says, hey, we don't want that in here. We want to get rid of it. So then you might spend the rest of your night hanging out over the porcelain throne. Not a fun night. You feel like garbage, but your body is doing what it's designed to do, getting rid of that pathogen so that we don't get a chronic, systemic, prolonged infection. The other thing that we like to talk about in our office is fevers. Fevers is a big thing these days. Fever is your body's way of fighting off an infection. If you get a bacteria, you get a virus, you contract that virus or bacteria, your body will raise your temperature naturally to help kill it, to help fight it, to help burn it out, essentially to heat it out. It also helps kind of turn on your white blood cells, your immune system, get things going. And so although we don't feel good, our bodies are doing what they're designed to do. The other thing that we like to mention is touching a hot stove. And so a lot of people might think, you know, pain is your enemy. I don't like pain, I want to get rid of pain. But sometimes pain can be your friend. So let's say you touch a hot stove. You put your hand out, you touch a hot stove. Your nerves in your hand that go to your neck and go to your brain are going to feel that. They're going to say, hey, remove your hand. If I have compression in my neck that's putting pressure on the nerves going down my arm, and I'm losing feeling in my hands, and I put my hand on a hot stove, I'm probably going to smell it before I feel it. So even though it hurts to touch that and it's pain, our bodies are doing what they're designed to do to keep us protected when we have pain. So those are some factors that can go along with different types of symptoms and how we can be functioning better even though our bodies are not feeling as good as they should. All right, let's talk about health. What is health? Let's define health. When we look at dictionaries, medical dictionaries, other dictionaries as far as health goes, health is never defined based on symptoms. Not one definition of health is based on symptoms. It's based on how our body is functioning. Optimal function equals optimal health. And so if you look at the screen, I have an equation down there, and it says health equals optimal structure times innate intelligence. Structure, being the structure of our bodies, is variable. It changes day to day, hour to hour, month to month, year to year. As we age, things change as well. Innate intelligence, if you've never heard these two words put together before, innate intelligence is our body's way of functioning, if you will, our wisdom on how to function. You are all sitting there, and I'm standing here, and our hearts are beating, our lungs are breathing, our blood pressure is regulating, our liver's detoxifying things, our bladder's, filtering things, and it's all happening without us thinking about it. That's what our innate intelligence is, the part of the body, the life in the body that keeps us alive, keeps us functioning the way we're supposed to. That is constant from the day we're born till now, and it will be. We just have to figure out how the structure of our bodies limits the expression of that innate intelligence. And to break that down a little bit, I bring in my good friend, if you look at the screen, Billy Joel. So Billy Joel is a good buddy of mine. We go way back. No, but anyway, he's a very famous artist. If you don't know who he is, you can go look him up. One of his most famous songs is The Piano Man. He's played this song tens of thousands of times. He could play it forwards and backwards and upside down and blindfolded without even thinking about it. So he in this equation is our innate intelligence, if you will. Let's say we give him a piano that's not tuned very well. It's missing some keys, the foot pedal's broken, and he goes to play that song the way he knows how to play it. It's not going to sound the way it's supposed to. So now, if we have the same guy, the same Billy Joel, the same song, but now we give him a nice, brand new, tuned up piano, and he plays that song the way he knows how to play it, it's going to sound the way it's supposed to. So the only variable in this equation is the structure and how it's allowing the expression of that intelligence. So I hope that makes sense. This whole first part was designed to talk about how health is not about symptoms at all. It was designed to talk about how health is about the function of our body and how the structure of our body allows us to function properly. We have a phrase, health is your birthright. We were all designed to be healthy. We were not designed to be sick. We were not designed to be ailing. We were designed to function properly and be healthy. We just have to figure out what limits our body's ability to do so. So let's move on to the real question. What limits our body's ability to function properly? To answer that question, we have to dive into a little bit of anatomy. So I have a question for you all. What is the most important organ in the body? Some might say heart. I've heard people say skin, or the kidneys, or the lungs, which are all important. We can't live without these things. But we can have a heart transplant. We can have a skin graft. We can have a lung transplant. Did you know that you can donate part of your liver to somebody else and yours will actually grow back? You can't do any of this stuff with the brain. You can't have somebody else's brain. You can't have a brain transplant. You can't lose half your brain and function properly. Our brain is where our innate intelligence is, if you will. It is the master control center. It controls the body. If I move my arm, that's my brain controlling my arm. If my heart is beating, that's my brain controlling my heart. And so the brain is the only organ completely encased in bone. And we have a skull to protect our brain. And like I said, that is where our innate intelligence lives, if you will. If we have no brain, we have no life. So the next question becomes, what is the second most important organ? If we have a brain and we have a heart and we have nothing to connect the two, the heart doesn't work very well, kind of like wiring in a house. If you have a light switch and you have a light and you have no wiring to connect the two, the light doesn't work. So we have then a spinal cord. Our spinal cord is the second most important organ in the body. It is almost completely encased in bone. I have a spine to show you what I'm talking about. We have vertebrae to encase our spinal cord, which runs all the way down through our spine. And so the spinal cord is the connection between the brain and the rest of the body. So let's talk about the spine, spinal anatomy. Your spine is made up of 24 individual vertebrae. We have 7 in our neck, we have 12 in our middle back, and we have 5 in our lower back. The cervical spine is the neck, the thoracic spine is the middle back, the lumbar spine is the lower back. And then this big guy down here is called the sacrum. It's made up of 5 bones when you're born, and then as you grow into an adult, it fuses into one big one. And then this thing down here is called your coccyx, or your tailbone, and it was 4 bones when you were born, and it grows into one as you become an adult. Over here we have the left and right pelvis, and then this makes up your SI joint. In between each bone, we have this cushiony material. It's called your disc. The disc is what we'll call the cushion in between the bones. And then this here, this little bulging part, this little red part, is an example of a disc bulge. Some of you listening to this, and as I talked about myself earlier, we talked about some of you have disc bulging in the spine. Some of us know it, some of us don't. But when that bulges out into that space, it hits that nerve. And those nerves here in your lower back go down your legs. If that happens in your neck, it goes down your arm. And it can cause pain, numbness, tingling, loss of strength, things like that into the arm or the leg. And so I wanted to mention that in case we ever have to talk to you about what a disc bulge is, you kind of have a visual of what that is. So moving on to the most important part of the spine, and that is your upper cervical spine. So we have your cervical spine, which is your neck, and then the top two bones in the neck make up your upper cervical spine. The top one's called the atlas, and the second one's called the axis. There's a number of reasons why these are the most important parts of the spine. One of them being there's different anatomy at this area. There's these joints through the rest of the spine called facet joints that interlock the bones above and below from keeping them from moving too much. There are no facet joints at number 1 and number 2. We talked about the disc earlier. There's a disc in between every single vertebrae. There is no disc in between number 1 and number 2. So it's a different area up there. The most important reason is as you have your brain, it conforms into your brain stem and then your spinal cord, and your spinal cord runs all the way down your spine and branches off in all of these spinal nerves through here. These nerves might go to your arms, they might go to your legs, they might go to your fingers, and they control your movements and things like that, your voluntary actions. The brain stem sitting at that top bone has nothing to do with your voluntary actions. It controls everything that happens in your body without you thinking about it. Your heart beating, your blood pressure, your lungs breathing, your digestive system, your immune system, everything that happens every day without you thinking about it, even when you're sleeping, is controlled by the brainstem. And so when that bone shifts off position, it puts pressure on the brainstem, and our bodies cannot function as good as they should. We are essentially cutting off those messages from the brain to the rest of the body, and this is why this is the most vital area in the spine, and this is why it is checked every time you come into the office. So how does my spine get this way? Sometimes people come into the office and they've been having pain for a day or a week, and we examine things, we take x-rays, and we find damage on the spine that's been there for years. And how does that happen? How does my spine have years worth of damage when I've only been having pain for a day or a week? And there's things on the x-rays that we can actually date back to injuries when we were kids, falling off swings and bikes and all kinds of maybe playground incidents as well. Maybe you thought it was funny when your friend went to sit down and you pulled the chair out from behind them and they hit their tailbone on the floor. Things like that can cause damage to our spine that translates into stuff that we have as we are adults. Now, sometimes we see babies in our office. Now, it'd be good to show you what I'm talking about. I wish I had a baby. Oh, hey, got one. So sometimes we see babies in the office. Now, how in the world does a 6-week-old, a 2-month-old baby have a spinal problem? They've never been dropped. They've never, been in a car crash. They've never fallen. They don't have all these years worth of damage. How in the world does a baby have a spinal issue, spinal misalignment? Well, a lot of things can happen during the birth process. Sometimes they have to pull on the baby's head or neck region to get the baby delivered. Now, I'm not saying this is a bad thing. It has to happen sometimes, but it can put a lot of pressure on the baby's neck. There was actually a study done a while back to see how much pressure was put on the baby's neck. They used a bunch of OBs to do their normal delivery process, and in the study, the average OB was 170 pounds. The average baby across the board is about 7 pounds up and down from there. The average pull on the baby's neck in the study was 70 to 90 pounds of pressure. So imagine, I would never do this, but imagine if we held a baby like this, that's about 7 pounds or so hanging off of that neck area. Could you imagine 70 to 90 pounds of pressure? That's a lot of pressure at that area. So it is not my opinion that every baby needs to be adjusted, but I do believe that every baby needs to be checked. I checked my kids when they were 3 days old, and neither one of them needed to be adjusted. So it's not that they need to be adjusted, but during the labor, the delivery process, even the pregnancy, things can happen within the baby's spine that if not corrected now can result in problems down the road. Some babies even have symptoms when they come into the office. We see babies for a number of reasons, but some of the most common ones are colicky babies, babies that aren't sleeping, they're crying, they have digestive issues all the time, sometimes ear infections, things like that are very common in the office. So that's just a little bit of information about babies, if you guys were wondering about that, so that way you can, have that knowledge for yourself or pass it on to somebody else. So we can even have damage to our spine as we're adults, falling on the ice, falling down the stairs, bumps in the head, all kinds of playing sports, all kinds of things. Again, we can name a lot of ways that our spines end up the way they are with all the damage that they have, work stuff, all that kind of stuff. One of the biggest reasons people come into our office and have damage to the spine is car crashes. Whether it was a car crash a day ago or 10 years ago, a lot of people might think that unless it was a massive rollover, totaled car collision, I'm okay. When in actuality, there's a lot of research showing that you can have damage to your spine at as little as 5 miles an hour. And this comes into play when we have low speed rear end collisions. If you are, say you're sitting at a stoplight, you're not paying attention, you're waiting for the light to turn green, you're looking off into the distance, and somebody comes up to you and bumps you 5 miles an hour, 10 miles an hour, you might not have any damage to your car. There are parts of your car that are designed to crush and crumple and absorb impact as you get hit. If you get hit from behind, you're not ready for it, you're not paying attention, and if there's no damage to the car, then all of that force gets put into you. We even have videos of especially young females getting in crashes that get rear-ended 5 miles an hour, 10 miles an hour, and they do this massive whipping motion to the neck. And all this is to say that if you are ever in a crash while you are under care with us, we need to know about it. Whether it was big or small, whether you think you got hurt or not, we at least need to talk about it so that way we can figure out if there's something different, something new that has changed, different injuries, different ways that we need to adjust you, things like that. So if you're ever in a crash, let us know. Other things that cause us bodily harm are toxins and stress. Toxins in our medication, toxins in our food, stress, whether it's mental or physical, all of this stuff can cause us issues and damage to our bodies, damage to our spine. Sometimes we'll get into people with in-depth conversations about nutrition. We don't have to do that on this video, but if you ever want to have an in-depth conversation about nutrition, what to eat, how to do it, there's a lot of information out there. We'd be happy to sit down with you and talk to you about what we can and can't do with nutrition. But in general, if we can eat better, if we can eat more whole foods, less processed foods, less boxed things, more meats and vegetables and fruits, the better off our bodies will be. I promise you, you'll heal better, you'll feel better, you'll sleep better, you'll hold your adjustments longer. We actually have a box of a McDonald's Happy Meal in our office. And I get it out and I show it to people sometimes, and there's no mold on it, there's no bugs on it. It sits in a cabinet 24 hours a day, 7 days a week, and it has for 12 years. This is to show that it's not real food. And so I like to pick on McDonald's because we have one of the Happy Meals, but the more we can stay away from these processed, these fast food type of things, the better off our bodies will be, the better off we will heal, and the better off our bodies will function. So all of this stuff, all of this damage, all of this physical damage, mental damage, food damage, whatever it is that's happening to the body accumulates over the years, and our bodies end up the way they are today. Now, one thing I want to talk about is you all might know who Christopher Reeves is. Christopher Reeves, if you don't know, was an actor a long time ago, played Superman in the movie, and he fell off a horse and he broke the top 2 bones in his neck. And from that point forward, he was paralyzed from that point down, from this point down, couldn't breathe on his own, was on a ventilator, couldn't walk, couldn't do much of anything on his own. And then eventually passed away. And now this is a sad story, it's not a fun story, but it's a testament to how much is going on at this area. He didn't break his arm, he didn't break his leg, he broke the top 2 bones in his neck, and nothing functioned from that point down. And so nothing's broken up here, but when that bone is off position and there's pressure on the spinal cord, pressure on the brainstem, the body is functioning, but it's not functioning as good as it possibly could. It's not healing, and it's not feeling as good as it possibly could. And that is why this area is so important. It affects both aspects of our nervous system. There's one portion of your nervous system that helps you move. It's the voluntary motions. If I want to move my arm right now, I can. If I don't want to move it, I don't have to. And then the other part of our nervous system that keeps us alive, that keeps our heart beating, our lungs breathing, our blood pressure regulating, all the stuff that's happening every day to keep you alive is also part of our nervous system. And so if you look at the charts and you come down to the base of your neck and you follow that nerve down, say you have a pain right there, and you follow that nerve down, where does that go? That goes down my arms, that goes down maybe it's your legs or whatever it is. And then we go to the other chart and we find, oh, that pain's right there. Where does that nerve go? Oh, it goes to my heart, it goes to my lungs. And so the big problem is not necessarily just the pain and where it's at, it's where does that nerve go, what's being controlled by it, and now what's malfunctioning because of it. We have a word we use in our office sometimes, and you've probably heard it before. It's called subluxation. When this bone's out of position, it's called the subluxation. That's what we correct in our office. That's what we check for in our office, is a subluxation. There's different factors to this, being pain and tenderness and inflammation and swelling. But the top two, the main two that we check every time you're in the office, are temperature. That's why we scan you. That's why we get those heat readings. And then leg balance. And that's why we lay you face down and we check your leg balance every time you're here. We don't lay you face down just to adjust you. We lay you face down to check your leg balance and check the scan, because if this top bone is not in position, it doesn't matter what we do to the rest of the spine. Nothing's going to work as good as it could or should, and we're not going to get the changes that we could or should if this bone's out of position. There was a study done a while back by a doctor, not a chiropractor, but he talked about subluxations. And a lot of people might have tons of pain. They might think, man, there's a Mack truck parked on my nerve and it hurts so bad. But in reality, the weight of a dime is what he said. The weight of a dime on a spinal nerve can cause as much as 60% decreased transmission of that nerve function. And so if it's a nerve going to my arm, I might lose strength. I might lose function. I might lose feeling. If that's a nerve going to my heart, I might lose function in my heart. And I don't know about you, but I don't want my heart or my lungs or whatever it may be functioning at 60%. I want it functioning at 100%. Let me give you an example. All of you know probably what carpal tunnel is. It's a wrist problem that's causing symptoms into the hand. And so there's a nerve that comes all the way down. It's called your median nerve, and it goes through your wrist. And if I find that nerve, put pressure on it, you've probably all fallen asleep on your hand before, and you put pressure on that nerve, you might get a little twinge. But if I hold that nerve, and if I continue to hold that nerve for minutes or hours, these three fingers right now are starting to swell a little bit, feeling swelling. They're starting to go a little bit numb. And if I left that go for so long, then my hand goes completely numb. But if I remove that pressure, those fingers start to come back online. So the problem was here, but it's affecting the nerves out here. The same thing happens with the spine. If you look at the chart on the screen, we'll see a skeleton with a leg length imbalance. And this is why we check your legs every time you come in, because when the top bone in the neck shifts off position, or the second bone, it creates a head tilt, and then the shoulders compensate and the hips compensate, and we get a short leg on one side. And so this is also why we can have one-sided hip problems or knee problems or ankle problems, because now our pelvis is shifted, and now every time we walk around, we're putting more impact on one side than the other. The spine's getting imbalanced, so we can have back issues and shoulder issues, all because that top bone is off position. In the office, we have 4 frustrations when it comes to seeing people in the office or even outside of the office. Frustration number 1 is putting off getting a problem checked. We call it our leaky roof analogy. Let's say you have a little pinhole in your roof and it rains one day and you get a wet ceiling tile, if you have like a drop ceiling, and you think, man, I don't have time to change that tile, or I don't have time to fix the roof. I have time to change the tile and get on with my day. And so you change the tile, you get on with your day. And then days or weeks go by, the hole gets a little more damaged, a little bigger, more rain comes in, you get 3 wet ceiling tiles, and you change those, and you keep going through this process over and over and over, and eventually the joists are moldy and the roof caves in and the floors are soaked, and now there's thousands of dollars worth of damage when we could have just fixed this little pinhole in the first place. We would have been a lot better off, and it would have been a lot easier to fix. We have the 5 most dangerous words that we hear in the office are maybe, it will go away. When common sense says something only goes away when what's causing it goes away. So that's what we're after. What is causing the problem to happen? How do we eliminate that cause and get back to functioning as good as possible? Frustration number 2 is covering up a problem. We call it putting duct tape over your check engine light. Hopefully none of you do that. If your check engine light comes on in your car, hopefully you take it somewhere, get it checked out, see what the problem is. That is our symptom in our body. If we have symptoms going on, something's wrong, something needs to be corrected, something needs to be checked out. If we just mask these symptoms with medications, whether it's pain or something else, we're not fixing the problem. We're allowing it to feel better for the time being, but in the actuality, it's getting worse as time goes on. So masking the problem is frustration number 2. Number 3 is missing appointments. We make this analogy of baking a cake. Let's say we have a cake recipe. Now, I've never made a cake before, full disclosure, so I don't know what goes in a cake. But let's say we have a cake recipe of 5, 6 ingredients. Say it's 6. and then we look at the ingredients and we have 4 out of those in our cabinet, and we don't have time to go to the store. You think, I got 4 out of 6, that's the majority. And then it says we got to bake this thing for 30 minutes. You put it in the oven, you bake it for 5 minutes, and then your friend calls you and says, hey, you want to go do this thing with me? And you're like, I got this cake that I got to take care of, and well, I can put it off and come back to it later. So you take it out and you put it in the fridge, and then you come back to it the next day and you put it back in the oven and you bake it for its full time. You're not going to have this cake that you could have had. You might, depending on what you put in there, have something that kind of looks like a cake, something that kind of tastes like a cake, but you're not going to have this nice cake that we could have had if we would have followed the recipe. And that's what our game plan is. If we follow the game plan, we have a good idea of what will happen in the end. If we do not follow the game plan and we pick and choose what to do and what not to do and what we can do and can't do, then we're not going to have that outcome that we should have at the end of everything. So frustration number 4 is we are in too big of a hurry. Everybody wants to feel better right now, and I wish, I really do, that we could adjust somebody one time and they feel better for the rest of their life and their body would function better for the rest of their life. But in actuality, our body has to go through a healing process. If you cut your finger, it'll heal. If you break your arm, it'll heal. But it doesn't happen in an instant. It takes time for that to happen. We have this thing we talk about, which is our 90-day healing principle, our 90-day healing process. We have to go through this process to allow the body to heal, which it will if you give it the means to do so, but it takes time for that to happen. Why does it take 90 days? I have no idea. This is when I like to ask people, why does it take 9 months for a baby to be born or a baby to develop? Why isn't it 2 weeks or 10 years or 5 months? It's 9 months. That's the way the body was designed. That's the way the body heals. That's the way the baby develops. We can't have a healthy baby in a month or 3 months. We have to go through that whole process, that 9 months to get a healthy, fully developed baby. So we have to go through this 90-day healing process to get our bodies back on track to what needs to happen through this whole process. So we mentioned earlier, health is your birthright. We were not designed to be sick or ailing. We were designed to function properly. Health is our birthright, and this is why. When we have conception of a human being, we have one cell and we have 2 cells, and they come together and they form one big cell. And that cell is called your parent cell. And then that cell starts to split into 2 cells and 4 cells and 8 cells and 16 and 32 and 64, and do the math. I'm not good at math either. So once we have all of these cells, they are all called stem cells. Every single cell that's splitting off of that first cell has the exact same parts, has the exact same DNA, has the exact same stuff. And so eventually, down the line, we start to form heart cells and lung cells and blood cells and bone cells and all these different cells, and they're all different. So do we think that just one day, all of a sudden, this cell's like, I think I'm going to turn into a heart cell today? It doesn't happen that way. When we have enough cells, we form this thing called the primitive streak. The primitive streak turns into the notochord, and the notochord turns into the spinal cord. And then our nervous system develops. When we're developing in the womb, we actually form our brain stem first, not our brain. We don't need our brain to think and talk to people and solve math problems and learn stuff. We have to function. We need our hearts to beat, and that's where the brain stem comes into play. So we form our brain stem, we form our spinal nerves, and then from there, the nervous system directs the formation of the cells, the tissues, the fetus. And once we have a fetus and we have that baby born, the nervous system controls all the processes in the body. Our blood pressure regulation, like we said earlier, our heart beating, our lungs breathing, our temperature regulation, every single thing is controlled by the nervous system. So we are also in a constant state of healing. We're always making new cells to get rid of old cells and replace those old cells. Like say for instance, if you get a sunburn, your skin dies, it falls off, you don't run out of skin, you get new skin. The same thing happens with our bones and with our heart and with our stomach lining. We're always getting new cells to get rid of old cells. The nervous system is in control of that process. So what if there's interference to the nervous system and there's a problem with how these cells are being manufactured, if you will? Maybe we have one cell that's a little bit off. And then from that cell, there's another cell that's a little bit more off and a little more off. And then eventually down the line, days and weeks and months and maybe years down the road, we then have millions of cells that are bad, and we have diseases. And so we have to get our nervous system back on track and functioning the way it's supposed to so that we can make better cells and our bodies can heal and feel the way they're supposed to. If you look at the screen, one of the pictures in the top corner is a car tire parked on a garden hose. Now, another analogy would be, let's say that you plant some flowers in a flower bed and then you go on vacation, but you left your hose there to trickle water so the flowers will get what they need. And then you come back from vacation a week later and you see that your flowers are wilting and they're dying and they don't look so good. And you look around and you're like, what the heck? And you see that you parked your car on the garden hose. Now the flowers are not dead, so you don't dig them up, you don't, throw them away. You remove your car, remove the interference, and allow the water to flow so the flowers can get what they need and they start to grow and they start to perk back up over time. That is essentially what is happening within the body. Our goal is to remove the interference, adjust the bone in the right position so that way our brain can communicate with the rest of the body. Our nerves are free to function the way they're supposed to, so our bodies can function and heal and feel the way they were designed to do so. Let's talk about the current healthcare model, the current healthcare approach. We talked earlier about how we as Americans take about 80% of the world's medications. It's a huge number. And most of these medications are designed to treat a certain symptom, a certain part of the body, treating the body as an individual of parts rather than as a whole and how it's functioning. And that's not how our bodies work. And along with these medications come side effects. And then usually we take another medication to cover up that side effect and help that side effect. And there's a lot of money involved in all this. 80% of pharmaceutical companies' budgets typically go towards marketing. Americans spent about $300 billion on drugs last year alone. There are 10 pharmaceutical companies in the Fortune 500 list for a combined profit of $35.9 billion last year. And yet, with all of this being said, and us spending about $4 trillion on our health care, is our health really better because of it, as we rank super low and always have in how healthy our nation is as a country? Now, the other side of this is insurance. Now, if I owned an insurance company, even if my mission was solely to help people be healthier and get what they need, I would somehow need to turn a profit. And the best way to do that is based on a symptom model. They want us to do the least amount possible in the quickest time for the cheapest price. When we do that, nobody gets what they actually need. We just kind of patch things up and send you out the door, and then we are back in the same situation before. So we don't like to let somebody that's never seen you, never met you, never seen your x-rays, never examined you, dictate what we can and can't do, because when we do that, we never get what we're supposed to get or what we need to get for our bodies to heal and function the way they were supposed to. We kind of roll the dice. Do you want more money, more time, or more quality? We don't usually get all three. So to boil it all down, the purpose of chiropractic is to, number one, remove the interference, adjust the bone, get it in the right position so that we can have the brain stem, the spinal cord, the nervous system free of interference. Our brain can communicate properly with our body. Our nervous system's functioning as good as possible. Our innate intelligence is functioning as good as possible. So our bodies can heal better, they can feel better, and they can function the way they're supposed to so that we can have better health overall. So the next portion of things I want to talk about, I have 3 examples for you. And these are 3 patients that we've had in the past. And if you look on the screen, you'll be able to see their x-rays. And the first one is a young girl. Now this young girl was 11 years old and she came into us because she was having headaches. She was having migraine type of headaches for about 5 years. So about half her life. She's 11 years old. About half of her life she's having migraine headaches. And now they started off small. Now they're getting worse and more intense and more frequent. And so her mom brought her in. And a little backstory, she actually had to be pulled out of school. They started homeschooling her because she was missing so many days of school. She was traveling around the country doing softball and soccer, and they had to quit all that because she was having all these headaches. So her mom brings her in, and we do an exam, and we take x-rays for the first time. And the x-rays that you see on the left side of the screen, that first x-ray, is her initial x-ray. And if you guys remember what it's supposed to look like, it's supposed to have a curve in the neck. We're supposed to have the head sitting balanced over the spine, and her neck has lost all of its curve. It's very straight, and her head is shifted forward as well. So we adjust her, and we go through the process, and we bring her back, and we go through the game plan, and a month in, we take our second set of x-rays, our re-exam. And if you can look at that, the one in the middle is starting to get more of a curve back through it. His head's still a little bit forward, but we're starting to get a curve back in the spine. So we keep moving on forward with everything we're doing, and then in the end of everything, in the end of 90 days, we take our last x-ray, our last re-exam, and they look perfect. We have the head balanced over the spine, we have the curve back in the neck, and she moves that point into what we call maintenance. Now if we back up the first time I adjusted her, she had a headache. After that first adjustment, we didn't have a headache through the whole 90-day process. She's been having headaches for 5 years. No more headaches through the whole process. Now, if I would have said, that's great, your headache went away, see you later. Come back if you have a headache again. Come back if it hurts again. I might have seen her the next day. I might have seen her a week from now or a year from now, or I might never seen her again. But it's not about just the headache, because now we have the spinal structure changed so that not only do we not have headaches, but we have a better spinal structure for her to grow into. We have a better functioning nervous system for the body to function better, and so we have better health overall. Now, at the end of everything, she moves into maintenance, which means for her, come in once a month to maintain the spine. So she moves into this maintenance period where she comes in a month, then she comes in another month, and then I don't see her again. And I don't see her for about 1.5 years. And I get it. It's hard to do stuff about your health when you feel good. So she comes back in, she's starting to have headaches again. Not as bad, but still having headaches. And so we take another x-ray because it's been about 1.5 years. And if you remember the slide before, we went from the straightening to the curve to a perfect looking x-ray. And then we take the new x-ray and it looks like the picture that we have on the screen. Back to where we were. She's not necessarily going to take as long to correct things, but this is a testament to how it would have been better to maintain things where they're at than it would to go backwards to where we were. Now we have to kind of start all over again. So this is to say how important it is to maintain things where they're at. Now, the next one that I want to show you is a young lady who's about 35 years old. She came in because she was having pain in her neck, going down her arm into these 2 fingers here. She was actually starting to lose strength. She was dropping things, water bottles, coffee cups, things like that. And so she comes in and we take our initial x-ray. And if you look at the x-rays we have up there, it's a reoccurring theme. We've lost all the curve in the neck, the head's forward, but on her, she's starting to have bone spurs in the lower part of her neck, which is not good for somebody who's 35. It means she's had injuries in the past, and based on her symptoms, I'm thinking we probably have a disc bulge in her neck, putting pressure on the nerve going down the arm. And so we start adjusting her, start working with her, and a month in, we take new x-rays. And if you look at the slide, they look about the same as they did before. Symptomatically, she's doing better. Not as much pain, not as much strength loss. She's still having symptoms, but she's doing better. So we send her out for an MRI, and we get an MRI back, and it shows that we have a disc herniation in 2 parts of the neck, putting pressure on the nerve going down the arm. So we do things a little bit differently, and then we move on to the next process, and we take an x-ray at the end of everything, and they look perfect. This is the last x-ray on the right. So we got the big changes on the x-rays, the big changes on the structure of the spine, and at that point she has no pain in the arm, no pain in the neck. The strength's coming back. It's not 100% yet, but it's getting there. So she moves at that point into maintenance. Now, the cool part about her story is when I was going over her x-rays, I was saying, this looks really good. We're moving into maintenance. Here's what that means. How's everything else? And I don't exactly know what I said. This was a few years ago. But what I meant was, how's your family? Because I know her family. And what she said to me was, it's great. I don't have any dizziness anymore. And I said, hold on a minute. Let's back up. I didn't know you had any dizzy problems in the first place. And she said, well, I didn't know that you worked with dizziness, and my neck hurt so bad when I got here, so I kind of just left it out. And I said, well, tell me about it now. And she said, I've been having these dizzy spells for the last 5 years. They come on 2 or 3 times a week. They last 5 minutes, 10 minutes, somewhere in there, and then they go away. And I've been to this doctor and that doctor and that doctor, and I've had all this kind of imaging and testing and medications, and nothing's really helped. And I figured I'm just going to have to deal with this for the rest of my life. She's 35. She has 4 kids and doesn't drive a car because she's afraid she's going to crash. And so in coming here, after about a month, she realizes my neck feels a little better, my arm feels a little better, but this is weird. I haven't had any dizzy spells in about a month. And I say that not because every person that comes to our office with dizziness or vertigo does better. I say that because I had no idea about what was going on with the dizziness. It's not about the symptom of the day. My neck hurts here, my eye hurts here, my foot hurts here. It's about overall getting the body to function as good as possible, getting the nervous system to function as good as possible, getting as much change and health back as we can, and we never know what can heal and change because of that. The last example I have is a guy who came in with a lot of back pain. It was shooting down his leg into his foot. He'd had this for years. He'd even gone to the point where he had 5 lumbar lower back fusions. He had every single vertebrae in his lower back surgically fused together with screws and plates over the course of 10 years. He's still having pain. So now they want to do an SI joint fusion on that side. And he doesn't want to do it because he's had all these surgeries and he's still having problems. So he comes in and he says he's got the surgery scheduled in about a month and a half. And so honestly, that's not a whole lot of time to change that type of situation. But I say, we'll give it a shot and we'll do what we can do. So if on the screen you look, there's x-rays of his neck. And the reason those are on here, because when there's a fusion that much in the lower back, it's hard for me to adjust as much as I would when there's not a fusion. So we start working with the neck. We start adjusting and keeping this top bone in position. So not only can we hopefully see change in the neck, but the body is at least functioning as good as possible. So we take those initial x-rays, we've lost that curve, the head shifted forward, kind of like we've been talking about before. And then we go 4 weeks later after working with him, and we take our next set of x-rays. And if you look on the screen, we now went from that one x-ray to almost perfect in 4 weeks. His x-ray has the head sitting balanced over the spine, we have more of a curve in the neck, and now he has no pain in the leg, no pain in the back, and he canceled the surgery. And I say this because that's not a very typical situation, but it's to say that when we change the structure of the neck and we keep that bone in position, we can most certainly change the structure of the lower back and how it's related as well. So in conclusion, we've explained how not to undo what we're trying to fix and how to get the most out of our care and how to get better faster. We've also talked about the 90-day healing process, how to follow the game plan, how to follow the recipe, that basic baking a cake analogy. And then we've also talked about how we were designed to be healthy and how our bodies were not designed to be sick and ailing. We're designed to function properly. We just now, and hopefully you know, have to figure out how that happens, why that happens, and hopefully you got some good information out of that as well. And there's a quote on the screen: health does not come from a potion or a pill, it comes from inside via the nervous system. Above, down, inside out. So thank you all for paying attention. Thanks for watching the video. Now, as part of all of this, we're going to move on into a couple rules that we have, a couple tidbits, things like that. So we'll move on into the next portion of things. So we have 3 rules when it comes to being a patient in the office. Rule number 1 is no begging for adjustments. Now, what do I mean by that? No begging to have this top bone adjusted. We check that bone every time you're in based on your scan, based on your leg balance. If it's out of position, it needs to be adjusted. If it's not out of position, we do not want to adjust it. It's like a light switch. If it's on, we can't turn it more on. It doesn't matter how you feel that day. It doesn't matter if what is hurting that day. Yes, we care about that. We want to help that, but we cannot adjust the top bone unless it is out of position. Let's say you come in day 1, your scan looks all wacky, and we adjust you, and then we scan you again, and your scan balances out to a better, straighter scan. Perfect. Scan or the adjustment went well. All is good. The body is changing. The body is healing. Holding is healing. And then let's say you come in down the road, and we scan you, and it looks very straight, and the legs are even. Perfect. You're holding your adjustment. Again, holding is healing. The longer this bone holds in position, the better off we will be, the faster we will heal. And then you say, man, but doc, can't you just adjust me again and make my headaches go away? No, it doesn't work that way. If the bone, again, is in position, we cannot adjust it back into position. We will do everything else in our office. We can do all the therapies we have. You can lay in the hyperbaric oxygen chamber. We will do all the muscle work in the world. We will do everything we can to make you feel better, but we cannot adjust the top bone if it is not out of position. So that's why that's rule number 1. Rule number 2 is always keep appointments. Following that cake baking analogy, that recipe for success. If we follow the game plan, we have a good idea of what will happen in the end. If we do not follow the game plan, we have no idea. And this also goes to say, let's say you have 14 visits that are part of your care plan, and you're supposed to get them in 3 months, 90 days. But then we get those 14 visits in, but it takes us 9 months to do so. We're not going to get the same change that we could have had if we would have gotten it in the time frame that we were supposed to get it in. So that's why rule number 2 is always follow the game plan, always keep your appointments. Rule number 3 is kind of twofold. Number 1 is thank. If a person sent you in here, if a friend of yours, a family member, a coworker, they sent you in here to see if there's something that we could do to help you, please thank them. They cared enough about your health to see if there was something that we could do to help out with your health, so we urge you to thank them. The other part of this is tell. One of our goals and our missions is not just to help patients with pain and things like that. It's to have a healthier community around us and help as many people be healthy and function as good as possible. And so if you're having a fun time, you're having a good time, you can tell everybody that you come to the Kessinger Clinic. And if you're having a bad time, you can tell everybody you go to the guy down the street if you want. No, I'm just kidding. Don't do that. Just a joke, everybody. So, but if you can spread the word, if you can tell people about what we're doing here, we can hopefully help this community be as healthy as possible, help their bodies function as good as possible as well. So again, thanks for paying attention. And one of the other things that I have for everybody is we have some rules, some little tidbits of holding your adjustments, how to hold your adjustments better. So that's going to be the next portion of things. So lastly, I want to talk about some exercises that we want you all to start doing to help you hold your adjustments longer, things like that. We have neck exercises, and then we have lower back exercises and core things. The neck exercises we don't want you to start doing yet until we do our first re-exam, but I'm going to kind of show them to you now, so that way when we go over them later, when it's your re-exam time, you'll kind of have a refresher course. And so basically they include 3 motions, and it's designed to, once that bone is in the right position, we now have to exercise the little muscles in between the bones, in between the joints, to help the joint hold and strengthen so it holds longer, the adjustment holds longer. Basically, you're going through your range of motion sideways, bending like this, and you're going through your range of motion turning and turning like this. And then the last one, we want to do head forward and head backwards like so. And we're trying to bring the head back over the spine. And again, we're going to go over these again when it's your re-exam time. I just want to give them to you now, so that way you have a refresher down the road, but don't start these yet. So the next portion of things is for the core, for the lower back. And even if you don't have any lower back problems or pain or symptoms, this is something that everybody can do to help stabilize the area. And the first one's called a quarter squeeze. And it's called a quarter squeeze because it's like trying to squeeze a quarter between your glutes. And so basically what you do is when you're sitting down, you flex your left glute muscle and you hold it for 5 seconds. And then you flex your right glute muscle and you hold it for 5 seconds. And then you flex them both together and hold it for 5 seconds. And then do that 5 times in a row, 5 times a day. And it's designed to strengthen the little intrinsic muscles that are typically weak in people that sit a lot throughout the day. The next one is called a vacuum. And basically you take a deep breath in, you blow it all out, tighten your core together, hold that breath for 15-20 seconds, breathe normally, go about your day, do it again when you think about it. Don't breathe, do it again, and then breathe and do it again. Not such a good thing to do that. So do it once, go about your day, and do it again when you think about it as much as you can throughout the day. The last one is called a piriformis stretch. And basically what you do is when you're sitting, you cross one leg over the other, and then you lean forward until you feel a stretch in your piriformis muscle, which is down by your glutes. And then you hold that for 15 seconds or so, and then you uncross, cross the other leg, and do the same with the other leg. The reason we do this stretch is because your piriformis muscle is a muscle that your sciatic nerve runs right underneath, and it can get tight and tense, and it can pinch on your sciatic nerve, and that goes down your leg into your foot. And so if we can stretch this and relax this and keep it loose, we can hopefully keep from pinching on that sciatic nerve. So those are the exercises that we have for you all to start doing. Again, don't do the neck ones yet, but please, if you feel like so, do the lower back ones. So when you all got adjusted for the first time on the upper cervical spine, on the top bone, we went over some rules with you of taking it easy. Told you to take it easy for 5 to 7 days. Those rules probably included not lifting things off the ground over 20 pounds, lifting things overhead over 5 pounds, sleeping posture of sleeping on your back or your side, not on your stomach, making sure that your neck is in a neutral position and you don't have 3 pillows behind you pushing your head up or tilting to the side. We want to keep the neck in a neutral position if we're sleeping. We want to take care of the spine. We want to take care of the neck especially. So the longer you hold your adjustments, the better things will heal. So those rules apply every time you get adjusted on the top bone. If you come in and you got your lower back adjusted, we worked on your middle back between the shoulder blades, you don't necessarily have to take it easy, but every time you get an upper cervical adjustment, we need you to take it easy now for 24 hours. Meaning, again, the lifting, the overhead motions, working out, the chores, vacuuming, sweeping, painting, repetitive motions, mowing the grass, things that jar and jam the spine. Sleeping, again, is important. Always sleep on your back or your side. If you sleep on your back, you can put a pillow under your knees to elevate your legs to take some pressure off your back. If you sleep on your side, you can put a pillow between your knees to keep the pelvis from being twisted. Those are all kind of rules, if you will, on taking it easy, things like that. Some of the other things that we don't talk about a whole lot would be if you go get your hair cut at the salon, they might put you in this basin to wash your hair, and that puts a lot of pressure on this area through here. And so we urge you to not do that if you've just had an adjustment. Anything that's more strenuous on the neck, more strenuous on the back, that would, if it's questionable, we'd urge you to not do it for 24 hours so that way we can hold our adjustment as long as possible. And I understand some people can't follow these rules to a T because of their work, because of those things, but the longer, the better that we can follow these rules, the better off we will be, the longer we will hold our adjustments, and the more healthier we will be. So again, thanks for paying attention. Thanks for listening. Thanks for watching the video. We hope you all got something out of that and learned something and how to be healthier and how your body functions better and how to hold your adjustments longer as well. So have a good night, everybody.